Hi, my name is Paige, and I'm going to be the LPN student today. We're going to do some sterile wound dressing as well as sterile gloving for this skill. So we're going to start with our LPN welcome. Hi, my name is Paige. I'm going to be your LPN student today. I'm going to do some wound care and addressing the onion. Okay, so I've got all my materials and I've looked at my patient before we came into the room. So we're actually going to bring this table close. So I have a second. I have a sterile field and a non-sterile field.
You're gonna wash your hands, change your gloves. Yep. Those classic. No, not sterile.
Okay. So I would come in, wash my hands.
And then
So we're going to ensure safety, so the bed is locked and well covered. I'm going to bring it up to my height so I can perform proper patient care. Sorry.
looks like you're on a half a centimeter here. I'm gonna go and check and make sure.
Okay, so we are going to locate.
Good.
Sorry.
So I'm gonna go ahead and measure the length. It's around 2.5 centimeters, and the width looks like you're at a 3 centimeters.
Locate our patient ID. Could you tell me your name and date of birth, please?
Right. Wash my hands.
Mary Smith. Okay.
All right.
Okay, great. Thank you so much.
Take care.
Are you comfortable?
Grab my pin, initial.
You would obtain privacy. So I've already explained my procedure and she's safe. Okay, so I'm going to set up my materials now. So we have our sterile water. Everything on this side is not going to be sterile. This is a drink for the patient. This is to provide a barrier between the patient and the bed so we don't, we can catch drainage, things like that. We're going to try to maintain privacy here. So we have some Q-tips and some swabs and my sterile gloves. So I'm going to open my package away from my body to maintain the most cleanliness as we can. We're going to rip this clean off. Okay, now we can throw this out. So I'm going to set up my trash can over here.
That's what you call fenestrated drape.
Without breaking sterility of my container.
So if you would have, working on that wound.
So I'm gonna have and pour myself.
I have a nice little trash can here for myself. So at this time I'm going to change my gloves.
It just shows the area where you can work. You've seen it.
Hand hygiene again.
Things like that.
On the outside.
You watch the TV show.
New gloves.
Where they have like fenestrated drape and they're just putting stitches on, so it keeps this area clean. There's no debris that can make it. It's called a fenestrated drape. And you would use these.
So at this point we're going to create our sterile field. So we're going to take this carefully out of here. This point, remove this. Okay, and we're going to create a sterile field.
Because you know they have a shaft.
Without touching the inside of the paper.
At this point, sterility.
Okay, so now that we have a sterile field, we're going to go ahead and take our dressing off. We would dump our tray here. Without breaking sterility here, we would dump our tray right into our sterile field. Without breaking sterility, also we're going to get our sterile water, and we would lip it in the trash can. I wanted to note that I'm stepping back from my sterile field so I don't break my sterility with my non-sterile field.
Make sure he's at a safe position.
So we have lipped our container of sterile water. Now we're going to pour it into our tray. This can be disposed of. Okay, so at this point I would have you provide clean gloves for the patient to take the dressing off. So I'm also going to measure the wound as well as clean it.
Anything?
So we have clean gloves and we're going to take that abdominal pad off first, then the 4x4s, and then unpack the wound. So, Mary, this might hurt a little bit. I'm sorry if you're uncomfortable, okay? And gently take this off. Okay, we would dispose of this. But first we're gonna take all of this out, take the packing out. So at this point we would note what the wound looks like. So it looks irritated, it's quite red. There's some black, potentially necrotic tissue around the outside. It doesn't appear to have any drainage, but it does appear to be getting a little bit bigger as far as the edges go. So at this point we're going to throw this out, and we would come over here without breaking sterility, and you would get our measurement.
Think about it. You're taking here. Give me a swap.
Any swap? It's underneath the sterile tray.
Get a new one.
At this point, I would ask my assistant if she would bring me another Q-tip because it is underneath my sterile field, and I don't want to break sterility.
Q-tip. Q-tip.
Oh. Sorry for the delay. So, thank you to my wonderful assistant who brought me a Q-tip. Okay, great. So we're gonna open this at this point, and you would measure. Bring this out. We're gonna measure our wound. So we're going down to the deepest part of the wound. Okay. So we would measure. It's about roughly about a centimeter deep. Okay, so at this point we're gonna measure our wound. So we have a 13 centimeter in length, and we have 3.5 centimeters at the widest point. So at this point you would dispose of both of these. So at this time you're gonna clean the edges of the wound with a chlorhexidine swab with clean gloves. So hand hygiene again.
You'll see it here when
Okay.
we do.
We have clean gloves.
Mannequin won't move, but you'll see it when we. You'll understand that when they.
Mary, are you doing okay? Okay, great.
So you'll see. Here's wrong.
So I would clean the wound with my clean gloves, not breaking the sterility still. So we have 3. So the first one's going to be here, clean and twist, slowly going down the wound. Now it's contaminated. Second one, other side, thoroughly clean the exterior of the wound. Now one more for good measure. Looks like this area didn't quite get enough, so we'll get there. Okay, dispose. So at this point, it's time to pack our wound. We're gonna get into sterile gloves for this part of the procedure because it is an open wound and we want to maintain as minimal bacteria as we can inside the wound. So I would take my gloves off.
Take that paper off.
Hand
That
hygiene.
is a big contamination.
Actually, instead of hand hygiene, I would wash my hands thoroughly with soap and water. So to put the sterile gloves on, we're gonna get our packaging here without breaking sterility on our tray. This can be disposed of. So the outer package we're allowed to touch with our hands. So we would open our sterile gloves. We're gonna open the farthest tab first, away from our bodies, and then the one closest to us, and the sides. So thumbs are to the inside. I'm gonna dress my non-dominant hand first. So which would be my left. So I'm gonna take my right hand. Okay, well we can fix that. Actually, is it just me or are we missing a finger? The wrong way. Okay. Well,
It comes in the cup.
okay. I would fix this as soon as I get these ones on. Okay, I would get my fingers underneath this lip here. Okay, and this time we're gonna do this the correct way. So my fingers are still sterile. So we're okay so far here. For the love of goodness. Okay, we are gonna get our hands in there here. Okay, sorry about that. At this point my hands are both sterile so I can fix my gloves. Okay, and we've maintained sterility. dispose of this, drop it over our garbage, okay? At this point, we're gonna keep our hands above this level and above our sterile tray level so we can maintain sterility. Okay, so I'm gonna take my forceps, because I can touch this area now. We're gonna take these gauze pads and get them nice and moist in this water, sterile water. I'm being mindful of where my elbows and my sleeves are, not to get them in my sterile field. I can touch this with my hands, so I'm gonna pull it apart, okay? And I'm gonna back up from my sterile field, and we are gonna put this into the wound, being mindful of the edges and not to contaminate the inside of the wound with the outside bacteria. So this is a pretty shallow wound, so we're not gonna pack it too much. I would have noted with the Q-tip to see if there was any tunneling, and when I pulled the packing out, I would have made sure that there was no excess packing and any tunneling, by the way. However, this is a shallow wound, and so I recognized that and did not verbalize that. So again, we're going to try to maintain the edges of the wound. Okay, looks pretty good. So we're going to dispose of this. We don't need that anymore. So now that we're still sterile, we can take these gauze pads and cover the wound. Okay, so we're going to take both of these and cover the wound. Alright, so now at this point we would take our ABD pad. Are you still doing okay, Mary?
Sorry.
Okay, great. So we are no longer sterile. The wound is covered, so I can tape the wound. I could have used non-sterile tape. So we do the best we can here to tape this down all four sides because it's not an inclusive dressing.
No, it's okay. No, I wasn't talking.
Got it? We're doing okay. We're trying not to apply pressure here to the wound, but we are trying to get this to stick. One more, sorry. Okay, last piece. Sorry about that.
Do you have any questions or any concerns? And then I do see that you have a so iodine, so I did bring extra alcohol also that we don't have to use iodine. So first, I am going to
Well, we're doing a little bit better here with the tape. Okay, at this point, I would initial date and time my bandage. So it's 10/31, happy Halloween, 19, and the time is 1:35, so 13:35. Okay. All right, at this point, I would dispose of all my materials. I'm no longer sterile, so we're gonna make the patient comfortable. Are you doing okay? Okay, we're gonna ensure safety. The bed is locked and low now. Do you have any questions or concerns? No? Okay, so I'm gonna dispose of my materials,
Okay, wait, I'm freaking
including
out
my
now.
gloves.
So I need to put it, it's okay if I go over to while you, okay, what are you saying? What's your cut? Huh?
So all of my materials I would dispose of, as well as my gloves. And I would disinfect my area as well as my hands. And I would unprovide privacy, and I would leave the room to document my findings of the wound. And I would wash my hands.